I am Mrs. Jaffe and Mr. Jaffe's son. I maintain a fellow status in a half a dozen different societies. I'm a senior fellow of the Health Studies Collegium Foundation, where we have the PIH Academy. For any of you who want to get more intensively trained, the PIH Academy is for you. I'm founder and chairman of PERC Integrative Health, ELISA Act Biotech, and RMJHRX, from which you can either conclude I'm easily bored or have a Jewish mother, or both. I'm fairly easy to reach. We do social media, we do IG Live, we do YouTube videos, we do Reels. I don't even know what these things are, but I have a team of people who produces them for me, and they make me look good. So please tune in to our IG Live on Thursday at 11 a.m. East Coast time. That's the advertisement. Now I'll get on to the talk. Clifford tests are more needed today than ever. And if you use the Clifford test to guide your therapy, or use Clifford tests and LRA tests to guide your therapy, you will get profoundly better wound healing and shorter recovery times. Because the toxic effects of heavy metals, environmental chemicals, additives, and excipients burden the immune defense and repair system. If you have too much defense work, your immune system can't do repair. If your immune system cannot do repair, you get inflammation and you get old quickly and you feel terrible. Clifford metals testing, CMRT, we have revalidated the Clifford method. We do it exactly the way Jess did, and we provide the results, and a new interpretation which is continuously improving. Understanding the immune system in health and chronic illness is very important. Host hospitality, your vulnerability or susceptibility to infection, to inflammatory process, to slow wound healing is important. But inflammation is really repair deficit. I'm going to say that again. What we pathologists call inflammation in physiology and in life is called repair deficit. Repair deficit is an opportunity to correct the repair deficit. Inflammation is 5 different kinds of tsaros. If you don't know what tsaros is, I'll tell you later. Tsaros means bad things in Yiddish. Incorporation of metals reactivity testing and lymphocyte response testing into functional protocols provide dramatically better recovery, wound healing, and the like. So, how do we determine toxic metals and their links to ill health? First of all, I want you to be paid for the value of what you do. I want you to be able to link toxic metals to acceleration of chronic illness. And if people want to recover from chronic illness, they need to get the bad out and the good in. You can say that several times. Get the good in and the bad out, get the bad out and the good in. Eventually they will figure out that they are doing vicious cycles, not virtuous cycles. And you want them to have virtuous cycles that repair as well as defend. And by the way, if you want to eliminate cancer cells, which I hope you do, if you want to eliminate cancer cells, your immune defense and repair system has to be in repair mode, not defense mode. So many reasons. I'm going to talk about how to assess body burdens. There's the amount of toxic metal, then there's the immunotoxicity of the toxic metal. They're different. How do you practice safer detoxification, both for yourself and for others? It turns out that a dental office is almost always, and I hope you are all the exception to this, a very toxic place. So be very, very careful with the toxins. Stop them at the door, reduce them in physiology, reduce them in the body, and measure. Make sure that you and your staff are safe and that your clients are too. Now, dental materials, you know this better than I, but amalgams have mercury and aluminum. Aluminum may be worse than mercury. Mercury is pretty bad, but aluminum may be worse. Porcelain crowns have aluminum, bioavailable aluminum, not safer aluminum, bioavailable aluminum. Root canals, yes. How many of you use gutta percha? How many of you do root canals and use gutta perchas? Congratulations. Continue to do that. Not too many hands went up. Zirconium and strontium. Well, they're just minerals, but they can be good or they can be bad, and we know the difference. Then you get to restoration and implants. Alloys with nickel, chromium, cobalt, titanium. Maybach, a dermatologist at San Francisco, proved that nickel coming off of hip implants caused hypersensitivity reactions and chronic disease. He became quite controversial, Maybach. Lenny Duell got the dean of UCSF to give him an award to stop the controversy. So nickel hypersensitivity is real. Some people will tell you that when they wear jewelry, very often the jewelry causes a discoloration of their skin. That's a hint that something is not right. So metal-free dentistry, is there such a thing? There's smart metals and there's old metals. You want to use smart metals. I actually have several appliances. I'm not going to take them out, but trust me, I have 3 appliances in my mouth. They're made of nylon, extruded nylon. These are relatively new. I have been using them for 3 years. My dentist, Dr. Bronson, is thrilled with the results, and no implant. I'm not ready for an implant. I think that the biologically compatible implant materials that are being researched in Scandinavia and will be available in about 10 years may have some hope. But putting metal in the body is not a good idea electrochemically. Go talk to the companies that make implants about electrochemistry. It will be a very short conversation. So we need to be aware of what we're doing to and with our patients so that they can thrive and, in the best of cases, fill your waiting room with their friends. So let's determine chronic illness links to mercury. Just to nail this point, I'm going to quote from the National Academy of Sciences, ATSDR, and EPA. At 1 part per million. I often have colleagues tell me there's only 1 part per million mercury, or 1 part per million lead, or 1 part per million nickel in the person. Well, that means 20,000 molecules per cell of your body. 1 ppm turns out to be a very high amount when it comes to minerals and metals. Bioaccumulation or bioconcentration is from 200,000 to 10 million fold for mercury. Bioconcentration is intense for mercury. Therefore, you should stop it before it gets to you, because if it gets to you, it will bioconcentrate until you intensively remove it with the help of sulfur molecules and ascorbate and magnesium and choline citrate, and we'll talk about that too. A study was done of 60,000 US newborns with regard to developmental impairment. One study was done in the Faroe Islands that confirmed the problem. Another study was done in the Seychelles Islands. A different methodology did not confirm the problem. Guess who paid for which study? About 20% of the population has CNS or renal damage from heavy metals. 20%, 1 in 5 people ambulatory today has damage in their kidneys or their brains, both central and gut, from heavy metals. What are the symptoms? Well, they're pretty pervasive. You could replace mercury with lead or cadmium or nickel or arsenic and pretty much get the same cognitive impairments, headaches, fatigue, joint pain, dizziness, anxiety, depression, autoimmune disease, metallic taste in the mouth, Metallic taste in the mouth has turned out to be very helpful in my limited medical work with a few people, one of whom had a very, very important husband. They lived on 110th and Riverside in New York, and she worked for Sotheby's because she wanted to work. She didn't have to. As part of her remedy, as part of her getting healthier, she, for a period of time, had this metallic taste in the back of her mouth, and I proved, both in saliva and in other provocative tests, that what she was offsetting from her brain was the mercury, lead, cadmium, and arsenic, all four. Boy, did she feel better when they were gone. But do you realize how many different specialties people might see before someone realizes that it's about heavy metal poisoning or immunotoxicity? Mercury. You and I get 1,513,333 micrograms per person over a 50-year lifespan. And I want you to live 100 years, which would be twice this amount. Look at the math. I'm not going to go through it. You can see the math. 100 tons, remember a ton is 2,000 pounds, 100 tons of mercury a year comes from Africa across the Atlantic to the eastern part of the United States. Another 100 tons comes from Asia in the same wind currents. You can't get away from them. You have to biologically detoxify them. You have to reduce them to the extent that you can, but more importantly, use safer biological detoxification, because at 1 part per million, there are 20,000 molecules per cell. 20,000 molecules per cell that concentrate in the metabolically active part of the cell and uncouple. They are oxidative burdens. You want antioxidants in abundance. You don't want oxidative burdens. This is just from coal combustion. The 1.5 million micrograms is just from coal combustion and medical waste. Do you know that people are a major source of mercury? People who have amalgams in their mouth who get cremated. So, 302,000 per year, each year. That's your inheritance as an American. What about dental material testing? There are benign forms of minerals. Their surfaces have been treated so that they do not leach, they do not dissolve, they do not off-gas, they do not dissolve. So there are some more benign, but as I've already indicated, I'm not ready for implants, I'm ready for appliances. Sensitivity testing is essential to ascertain reactivity, unless you're psychic. If you're psychic, you can know what's right and what's wrong for your patient. But I wouldn't put that in the chart. The form of the metals is more important than their presence. Very often, these metals are milled in such a way that optimizes their bioavailability, because it makes it a little bit easier, they think, to work with them. But there are mechanics. Most of the people that I know in the Bureau of Devices and submitting proposals to the Bureau of Devices think mechanistically, reductionistically. They make the Descartesian mistake. They are not functional. They cannot understand physiology. Don't even talk to them. If you want to understand, talk to each other. Talk to any of the members of this program. And I want to thank Rich Fisher for putting together, again, such a spectacular program. Dental materials candidates. You should test for immune defense and repair. You should assess endocrine organs. This means hormones. You should look at the liver and the kidney, because very often they are burdened, and that will impair your results. You can get severe allergy or what's called atopy. You could be a universal reactor. Do any of you have any patients who are chemically, environmentally hypersensitive? I mean, really, really, I'll bet they will find their way to you because you will listen to them and you will give them hope and you will give them reason for hope, and then hopefully they will allow you to follow through. There are more and more chemically sensitive people. I used to lecture for the Academy of Environmental Medicine many, many years ago when Ted Randolph was still active, when Bill Ray was still active, when some of the giants like Beatrice Strum-Hunter was still with us. I will just mention that galvanically active metals cause lots of problems. Galvanically means electrochemically. Now, with regard to CMRT, the way Walter Jess Clifford designed it and the way we do it today, it measures dental implants, fillings and crowns, joint replacements, mouth guards, adhesives, stents, surgical mesh, sutures, implants of any kind, and anything foreign to the body. So it's applicable both to dentistry and to orthopedics. This is what the report looks like. It's hard to read, but if you actually had it in front of you, you could read it. How accurate and precise? Comparable to testing used for evaluation of blood sugar and cholesterol. That's pretty precise. We are reproducible at that level of precision. You have to decide what to do with the results. We will help you interpret them. If you draw multiple samples over several days, the accuracy is about 95% or greater for CMRT. It's actually better for the LRA, but this is CMRT. Precision of repeated testing from single samples is about 97% or greater. We are improving the precision of the methodology by improving the method, and as we improve it, it will get better, but it's already pretty good. Testing items include 17,000 dental and 12,000 orthopedic materials listed by brand name. We try to tell you both what to avoid and what you can use, and then where to find it. There are other labs. There's another lab that kind of sort of does what Jess does, but they don't really, and they don't really tell you much about what they do, so I'm not going to talk much about them. Then there's Melisa, which used to be available. Vera Sketzel deserves to be honored and remembered, but Melisa is the prior generation. It uses radioisotopes to determine a few metals, whereas with our LRA tests, we can do hundreds of tests without a radioisotope more precisely and more with greater precision. So most medications, including antibiotics and antihistamines, will not affect this CMRT test. Antihistamines do affect the LRA, but not the CMRT. Contraindications to testing. Heavy, long-term immunosuppression, use of steroids at high doses for long periods of time. Do not intervene in a person on steroids daily, on daily steroids, at reasonable or high doses. You will run into trouble. For example, just one example, acupuncture doesn't work if people are on steroids. How do I know that? Queen Nguyen Wu was a brilliant acupuncturist in Washington, D.C. I did a 7-year apprenticeship with him in TCM and acupuncture. And among the things that we documented was that if people are on steroids, acupuncture doesn't work. Well, if acupuncture doesn't work, then a whole lot of other functional, physiological, and beneficial things will not work. And so if you try something that might work absent the steroids, and then it fails, the patient is less likely to try it again off the steroids. So help them taper from steroids first. There is restricted usefulness for children without a mature immune record. This means children below 1 or 2 years of age. It takes a year or two for a kid's immune system to mature and become independent from mom. If you have a young child and you want to test, test the mother. The apple doesn't fall far from the tree for the first year. The specimen is a red top vacutainer tube, standard serum tube. You can use an SST, a tiger top if you want, doesn't matter. We need about 3 mLs of serum to do the test, that's not much. You allow it to clot for about 15 minutes, then centrifuge. Don't centrifuge immediately, allow it to clot for 15 minutes and then centrifuge. We centrifuge at 1300 RPM for 10 minutes. That's very gentle. We just get rid of the red cells. There are 4 stages to wound healing. I said I would talk about wound healing, and I will. There's the first blood clot, which is actually mostly platelets and fibrin that stimulates repair. So there's bleeding, then there's inflammation. Inflammation is swelling and heat, and all those harmful things that pathologists taught you about inflammation are also part of the repair process. So when you see inflammation, give more polyphenolics and ascorbate, give more magnesium and choline citrate, give more of the essential nutrients like a super multi to keep their urine sunshine yellow. And the inflammation will go away. Then there's proliferation, which is repair. And then there's remodeling, which is to return the area to the way it was originally. So in proliferation, fibroblasts proliferate, they put down type 1 collagen, which is quick and dirty collagen, and then they come back, because when I was studying collagen and platelets in the 1970s, there were only 3 kinds of collagen. Today, there are over 25 types of collagen that have been identified. So you do a quick and dirty repair with type 1 collagen, and then you come back later to do a more complete repair with a differentiated collagen. Influences of wound healing. This is what is said, then I will reinterpret it. Age, nutrition, comorbidities, medications, and lifestyle. I would say that lifestyle is the most important and overwhelmingly the most important, because if your lifestyle includes lots of antioxidants and lots of repair molecules and lots of whole foods and lots of organic or biodynamic sources and good hydration and other virtuous edible cycles, eating for life. Age is actually an artifact. Age is actually an artifact. Age occurs when you have too little of the good and too much of the bad. At this moment, I am functioning at about half my biological age. However old you think I am, I'm functioning at about half that age. My main teacher, Bhante Dharmawara, we measured at 96 and 106, and in both cases, he consistently came out to being functioning between 35 and 40 years of age. So I put the information in front of him to see what he would say. He said, 40, that's a good age. So be not deluded that your age, which is on your birth certificate and probably on your driver's license, determines how you feel. I get restorative sleep, I jump out of bed in the morning. No, I don't jump. I stretch, then I gently get out of bed in the morning. But I am so grateful to have another day, because I had a near-death experience almost 9 years ago, and that will tend to get your attention. What about autoimmune conditions? Well, they affect millions of Americans. In terms of diagnosis, it's about 80% women, but I think that's diagnostic bias. If a woman has a muscle pain, it will likely be diagnosed as fibromyalgia. If a man has a muscle pain, it will likely be diagnosed as bursitis. Diagnostic bias exists in medicine. I know that's a shock, but it does. There are over 100 autoimmune diseases. There are many types of autoimmunity distributed throughout medicine. So if tolerance is lost, if your immune system is not tolerant, then you begin to attack yourself. If you attack yourself, you're in autoimmune disease. We want you to reset yourself by knowing what is attacking you and avoiding that for a period of time while taking supplements and hydration and activities and stretching. Eat, drink, think, do, a total comprehensive lifestyle program to lose the autoimmunity. Autoimmunity is a choice. Autoimmunity is a lifestyle choice. Yes, we have millions of people who don't know what to do or are doing the wrong thing. Most of the time when you talk to them, they are sensible people who don't realize that eating from packages and boxes is a bad idea. They don't know that shopping around the perimeter of the market, you might find some whole food, but if it comes in a package or a box or a can, be very suspect. I happen to have a permaculture biodynamic food forest in my front yard, and we still go to the greengrocer to shop around the perimeter to fill in. But I can pick quinoa and rosemary and basil and sage and parsley from the garden. Have you ever had the joy of going into your own garden, getting something that's edible, and then serving it for dinner? I recommend that. That's what I'm talking about. Tolerance restored. Yes, these are foundations of the immune system, which is the immune defense and repair system. There are food and chemical sensitivities. We talk about leaky gut and the microbiome. The microbiome is in. If you say digestion, they pay you less than if you say microbiome. We used to say metabolism. Now we say metabolome. There is abundant evidence that chronic autoimmune illnesses are potentiated by toxic chemicals and minerals, especially when they become immunotoxic, not just toxic burdens. Inflammation is repair deficit. Comprehensive detoxification and immune repair are the objectives. And we come at this with a very simple lifestyle program. It's about what you eat, drink, think, and do to nourish the immune system. It's a very personalized lifestyle program. We've done over 100,000 cases. We've done over 30 million cell cultures. We can take a health appraisal questionnaire and the results of our cell culture test and provide you a detailed lifestyle program. Now, there are lots of microbiomes. There's a microbiome on your skin and in your nose and in your mouth and in your lungs and in your GI tract. There are lots of microbiomes. You want them all to be happy. You want them all to be full of a wide variety of organisms. Eliminate foreign invaders before they get in. That's the job of your microbiome. A healthy skin produces opsonins, it produces secretory IgA, it produces a variety of chemicals that stop bad things from getting in the body. These are elective protective mechanisms. They only exist when you have the elective protective capacity that comes from a high intensity of supplementation, diet, and what your attitude is. I have taken care for the last 30 years of a guy who, by all rights, he had 5 different diagnoses, all of which were fatal when I met him in 1990. Today, he's a little bit worried because he can't skip rope. I said, why do you want to skip rope? He says, well, I want to keep up with the young people. I said, show them how to do jacks. Someone in the audience is old enough to know what that is, right? He is his own worst enemy. He can worry himself sick and he can think himself well. If you have a worried patient, you cannot say to them, don't worry. What you can show them is how to change behaviors so that the worry falls away. Do not confront the opposition. Do not confront the vicious cycle. Do not confront the worry or the distress. Give them a program that is so alive that the distress will go away. That's what we recommend. So, to review very quickly, there is an adaptive immune system. It has natural and artificial responses. Natural means passive maternal protection, or active, we get exposed in childhood to certain infections and then we become protected from them, hopefully, by having innate protection. Artificial protection, either passive antibody transfer or immunization, is different. If you want to know the details, talk to me afterwards. But they are artificial immunization is very different than natural. So I'm in the control group with regard to COVID. I will let you know I am waiting to get naturally infected and mount a T-cell protective response. I still get tested. I'm still negative. I'm in the control group. This is a slide that, if you would be so kind, come back and look at this slide, because there's a lot of information here, too much to actually go into. But the point is, there's a complicated dance going on between your immune defense and repair system, the inside and outside world, and you want all of this to be in harmony. You want all of this to be virtuous. You want all of this to work for you, based on what you eat, drink, think, and do. For example, every one of us has 50 billion dendritic cells able to recycle 50 foreign invaders. That means at any moment in time, if 2.5 trillion foreign invaders got in your body and these cells were healthy, they could recycle all of it and you would not get sick. If you brush your teeth, do you brush your teeth? That's a question. If you brush your teeth, between 50 and 100,000 organisms get into your bloodstream. Do you get sick from them? No. Most urine specimens that are diagnosed as infection are actually contaminated. It's hard to do a clean catch and then you have to culture it immediately. If you see 50,000 or 100,000 organisms on a urine culture, I'm telling you that's an artifact. Because bugs grow very quickly in urine. I just had someone in Bavaria who thinks I know what I'm doing, and the wife had a urine culture done and it came back 75,000, not 50,000, not 100, 75,000 E. coli. She had no symptoms of E. coli infection. Then she did a clean catch and cultured it properly. No bugs. So a few bugs might creep in, but they will multiply very quickly if you give them time. So if you take the urine today and you culture it tomorrow, I guarantee that most of those will come back positive. And then if you use that as the basis for antibiotic therapy, I'm telling you that's wrong. In fact, just for full disclosure, in the last 35 years, I have not needed nor written a prescription for an antibiotic. We've always been able to boost the immune defense and repair system so that it would get ahead of the infection naturally and natively, and not by inhibiting good and bad bugs, which antibiotics do. So we want to repair from daily wear and tear. We want to have a balance between defense and repair so that we are tolerant, resilient, and in balance. I'll bet most of you know when you're in balance and when you're not. Think about it. If we pay a little bit of attention to ourselves and ask ourselves questions like, am I in balance or not? I try to never make decisions when I'm not in balance. I try to never make decisions when I'm less resilient. This happens for hours at a time, not for too long. When I'm of clear mind and clear heart and have a healthy gut, then I can make decisions. So too often what we have is too much defense and too little repair. There's a critical need to tune up the immune system now. But here's one of the real problems. It takes 3 hours to 3 weeks from the time you get exposed until you get symptoms. These are called Arthus reactions, Schwarzman reactions, Jelen-Coombs reactions. I actually knew some of these people. I'm that old. If it takes 2 to 3 weeks to provoke a reaction, even if you have the perfect food diary, you won't be able to know what is causing the reaction. You need a T-cell culture. You need an LRA, lymphocyte response assay culture that will tell you what foods, what chemicals, what medications, what other environmentals are the cause of the problem. So when the patient says they're get up and go, got up and went, and they can't find it anymore, that's what I'm talking about. Now this is our version, but this comes from Jelen-Coombs, 1967, the 4 types of immune responses. There's type 1, which is histaminic, but the importance are IgA, IgM, and IgG. They could be good or they could be bad antibodies, so you have to distinguish good from bad antibodies. Then you need to get immune complexes. Then most importantly, you need to get T cells. T cells are more important with regard to COVID antibodies or reactions. T cells actually work without antibodies. B cells make antibodies, but T cells are immune competent cells that do not need antibody. And anything you have heard about COVID with regard to antibodies is passé. We are getting now the T cell tests that accurately know who's at risk and who is not. There have been many false positives and many false negatives. If you keep testing, eventually you'll go positive. What about leaky gut? What about the gut? Do you know if you have a healthy gut and I laid it out flat, it would cover an entire tennis court? That's how irregular the intestine is and how the 20 feet plus or minus 10 feet that is your intestine contains huge amounts of surface area when you are healthy, but many, many people, because of antibiotics and stress and other reasons, get enteropathy. They get enteropathy, atrophy of the digestive tract. On the left, you see a healthy intestinal lining, very irregular. To the right, you see damaged intestinal lining. That's enteropathy. That's very common. That means bad stuff can get in and good stuff has trouble getting in. I often go to the Goldilocks scenario and I go to good and bad. I'm a biochemist. I love the molecular biology. I love the details, but most patients want to know what to do and they want to know what's good and what's bad. So in explaining it to consumers, I often get to the Goldilocks scenario. Just right, not too much, not too little. We have just added to our digestive suite a stomach digestive aid. This is in the category of bitters, but it tastes good. It has dandelion, ginger. If you don't like ginger, you won't like this, but it has dandelion, ginger, burdock, and fennel to improve gastric acid production. We have worked very hard for many years to come up with a formula that 3 drops before each meal in something wet, 3 drops, will improve your digestive stomach function. You still need prebiotics, probiotics, and symbiotics, but you need digestive aid. 3 drops before each meal in something wet. We need prebiotic fiber, 40 to 100 grams a day. We need probiotic bugs, 40 to 100 billion live bugs a day. We need symbiotics, which means recycled glutamine. Glutamine is the energy source for the enterocytes of the intestine, but glutamine in high doses can build up glutamate. That's bad. So we recycle the glutamine about 10 times, so you take less glutamine recycled to get the maximum benefit with never glutamate buildup. So this quartet of digestive improvements this quartet for the microbiome is what I'm recommending that you incorporate almost universally into your daily regimen for yourself first, and then when you're thrilled and delighted with the results, you can share the good news. What about one of our self-assessments? We have 4 self-assessments, one of which is GI transit time. A healthy GI transit time is 12 to 18 hours. I was going to ask you what a healthy digestive transit time is, but I noticed it was on the slide. Healthy is 12 to 18 hours. Average in America is between 36 and longer than 96 hours. Very often what they eat on Monday comes out next Monday, creating all sorts of microbial disaster and parasites and hospitality to prions and on and on and on. Then there's also short bowel. Some people eliminate within 10 hours. That's not long enough to digest. You have to be concerned about short bowel syndrome. I don't think you'll see it very much. You should work with a specialist in short bowel syndrome for the few people that applies to. So achieve a healthy digestive transit time. Take charcoal capsules and check your digestive transit time. Do we need to detoxify? Well, yes. If you look at prestigious reports, impeccable reports, pregnant women are exposed to 43 or more xenotoxins as identified in their cord blood. Therefore, the baby gets exposed, the mother gets exposed. What they didn't do in this report was look at what to do about this problem. I'm here to talk about what to do about the problem. I'm sure you know the problem. The toxins come in, they concentrate in the liver or the kidneys. You want to make water-soluble wastes. There's phase 1, phase 2, and phase 3 detoxification. We have a triple detoxifier. It enhances phase 1, phase 2, and phase 3. Phase 3 turns out to be very important, the lipotropics, the flow of bile, the risk of gallbladder and liver disease. Now on to biodetoxification. Garlic, ginger, onions, broccoli, sprouts, and eggs. I think you know what I mean by garlic or ginger or onions. But I mean a whole bulb of garlic per person at the table. I mean a thumb-sized piece of ginger for each person at the table. I mean a whole red onion or several shallots. I prefer shallots. Broccoli sprouts have a lot to recommend them. Any sprouts are good. Broccoli sprouts have IP6 and sulforaphane. A guy named Talali has documented this. Broccoli sprouts are excellent, and they're also good to cook with. With regard to eggs, I mean duck eggs, goose eggs, and quail eggs. I don't mean chicken eggs. If you can get a biodynamic egg, that's fine. But even the organic eggs have too much bad and not enough good. So by eggs, I mean duck eggs. You can buy them in the Whole Food market or the green market. Quail eggs, goose eggs, eggs. Eggs got a bad rap from the cardiovascular world. Undeserved. So we also include glutamine recycled by PAC to give cell energy and to make these biodetox elements work better. How about a C cleanse, or what's called the ascorbate calibration? If you're formal, you call it the ascorbate calibration. If you're casual, you call it the C cleanse. It's the same thing. If you're healthy, moderately ill, or chronically ill, you take every 15 minutes a certain amount of ascorbate until you cleanse. If you've done the cleanse, you know what I'm talking about. If you don't, you probably don't, because the cleanse is so distinctive. The flush is so distinctive. Now, you're flushing out toxins and water, so this is actually good. But you have to explain to people the end point is not loose stool, it's to flush out as if you took an enema from within. We recommend this weekly. And then you take half to 3/4 of the amount determined by the cleanse on a daily basis. Ascorbate pumps toxins out. About the first 2 grams of vitamin C you take each day gets rid of the toxic metals from that day. So the first 2 grams. Now you've got to take more than that if you're going to get benefit. But the first 2 grams helps you safely excrete the toxic metals that came in that day. D-penicillamine I'm going to talk about very quickly. It chelates divalent cations. It is mercaptovaline. It is a simple amino acid. It stimulates nitric oxide production. That's a good thing. It increases sulfur phase 2 detoxification. That's a good thing. It's synergistic with phase 1 and phase 2 detoxification. That's a good thing. And I recommend it because it goes in and out of all compartments of the body, blood, cells, tissue, and it's oral. The provocation is for 3 days. There are other personal detoxification measures like D-glucaric acid, mercapturic acid. But a D-penicillamine provocation gives you the essential nutritional minerals, their status, as well as the toxic minerals. It turns out that when people have too much of the bad, they lack magnesium and zinc, among other essential minerals. So, the pharmacokinetics of ascorbate and D-penicillamine we can talk about. The therapeutic use and safer detoxification we can talk about. Combine GGOBE biological detox with pulse D-penicillamine as needed. Of course, include the ascorbate. Very often you can do biological detoxification without the D-penicillamine. But if you have a significant burden, the quickest way to get rid of that burden is to combine biodetox with a D-penicillamine provocation. Use the D-pen twice a week, like Monday and Thursday. Let the patient recover on the other days. You never give D-penicillamine every day. You always use it twice a week to get the benefit without the risk. We've briefly talked about D-penicillamine and biological detoxification, dental material testing, LRA tests for hypersensitivity to foods, chemicals, medications, and other chemicals. Magnesium turns out to be not just balancing out calcium, but magnesium helps in every way to get rid of the bad. So you need 1 molecule of magnesium for every ATP. You need the proton gradient, which magnesium uniquely sets in the cell. So deficiency of magnesium can cause lead and cadmium to accumulate. So you give magnesium with choline citrate to triple the uptake of magnesium, and then you correct the choline and the citrate deficiency. So we recommend magnesium with choline citrate. 220 to 880 milligrams per day in divided doses. Magnesium displaces toxic minerals, protects fats. Choline helps build acetylcholine and cholinergic bile salts, which get the bile out of the liver and gallbladder. And citrate energizes and alkalinizes because it's a Krebs salt. Only choline citrate works, choline bitartrate doesn't work. After rest, we recommend that you check your urine pH. So after rest, 6 hours of rest, you can go to the bathroom, you just can't go to the gym or the kitchen. 6 hours of rest, and then you check the urine pH. That tells you how much magnesium to take. The healthy pH range is 6.5 to 7.5. That's the Goldilocks scenario. Less than 6.5 means metabolic acidosis. More than 7.5 means catabolic illness. Those are both bad. So the goal value is 6.5 to 7.5 in the urine after rest. This is a table that we would be happy to send you for free as an electronic download that tells you the alkaline or acid-forming nature of foods. You want to eat 60 to 80% from the alkaline side. Now let's talk a little bit more about pro-repair, pro-detox nutrients. Ascorbate, dark fruits, they're superfoods. Dark berries, dark fruits. It happens to be a pomegranate. And they're rich in polyphenolics. B factors sufficient to keep your urine sunshine yellow. Keep hydrated with whole greens, high sulfur foods, GGOBE, and omega-3 enrichment with healthy fish, and most importantly, supplements that are distilled under nitrogen to get rid of the bad and concentrate the good. So Jeff Clifford and his family contributions are legendary, and I am grateful to continue his work in his honor and memory. Toxic effects of heavy metals, environmental chemicals, additives, and excipients are a big problem, and you are leading the way to healthier solutions and resolutions for your people. Restore immune tolerance and correct repair deficit, better wound healing results. In summary, we've briefly entertained you, I hope, and inspired you to carry forward with these approaches to immune system health in good health and in chronic illness. Host hospitality and vulnerability, we've talked about. We've defined the toxins in an individually relevant way. We've looked at dental and orthopedic material testing, delayed allergy testing, and pro-repair, pro-detox nutrients. I think we might have a minute or two for a few questions. If there are any questions, I am very grateful to be back here with you, and I hope that you will be with me well and happy for many years to come.